It is estimated that 33% to 50% of all pregnancies end in miscarriage or a spontaneous abortion before a woman misses a menstrual period or even knows she was pregnant. About 10% to 20% of women who realize they are pregnant will miscarry. A miscarriage is most likely to happen within the first 3 months of pregnancy before 20 weeks gestation. Only 1% of miscarriages occur after 20 weeks gestation. These are known as late miscarriages. What causes miscarriage? Studies show that 50% of all miscarriages that happen within the first 12 weeks, also known as the first trimester, are caused by chromosomal abnormalities, which are either hereditary or spontaneous. Chromosomes determine all of a person's physical attributes, such as sex, hair and eye color, and blood type. Most chromosomal problems occur by chance and are not related to the parent's health. Chromosomal abnormalities are a common reason why miscarriage and stillbirths happen. In most cases, scientists cannot determine the exact reason why chromosomal abnormalities lead to miscarriage. One theory is that the mother's immune system recognizes a defect in the developing baby's genes and thus terminates the pregnancy. A second theory is that the developing embryo ultimately enters a stage where the specific genetic problem causes the baby to stop developing. The developing fetus may not have certain genes that are vital for growth and development, or the fetus might have extra copies of certain genes that might cause the baby or placenta to grow improperly. This may be the reason why some chromosomal abnormalities lead to miscarriage while others do not. Cell division is a complicated procedure with a number of things that can go awry, so it is no surprise that occasionally things do go wrong. A sperm or egg cell may develop more or less than the 23 chromosomes needed to make a healthy baby. Chromosomes may be missing or have extra pieces, which ultimately cause problems such as miscarriage, stillbirth, or genetic disorders. While half of miscarriages occur because of chromosomes abnormalities, researchers have found miscarriages and stillbirths occur for a variety of reasons, including approximately 12% of repeated miscarriages are due to an incompetent cervix, also called a cervical insufficiency, which occurs when weak cervical tissue causes or contributes to premature birth or the loss of an otherwise healthy pregnancy. Before pregnancy, your cervix, the lower part of the uterus that opens to the vagina, is normally closed and firm. As pregnancy progresses and you prepare to give birth, the cervix gradually softens, decreases in length, and opens. If you have an incompetent cervix, your cervix might begin to open too soon, causing you to give birth too early. In most cases, there are no symptoms of uterine abnormalities, and the problem is not discovered without pelvic examination or imaging studies. Women with uterine abnormalities may suffer higher preterm delivery and first trimester miscarriage than those with normal uterine anatomy. Studies show that the likelihood of miscarriage is influenced by the age of the mother, for example. In women under 30, 1 in 10 pregnancies will end in miscarriage. In women aged 35 to 39, 2 in 10 pregnancies will end in miscarriage. In women over 45, half of all pregnancies will end in miscarriage. When a miscarriage occurs after the first trimester of pregnancy, it can be the result of an underlying health condition in the mother. These late miscarriages may also be caused by an infection around the baby, which leads to the bag of water breaking too soon. The following infections may also increase your risk: rubella, cytomegalovirus, bacterial vaginosis, HIV, chlamydia, gonorrhea, syphilis, and malaria. A miscarriage can also occur due to food poisoning. Food poisoning is caused by eating contaminated foods, such as food containing listeriosis. Listeriosis is a kind of food poisoning caused by Listeria bacteria. During pregnancy, you can pass the bacteria to your baby. This can cause problems, including miscarriage, stillbirth, preterm labor and premature birth, low birth weight, life-threatening infections in your baby, including bacteria in the blood, and meningitis. Meningitis is an infection that causes swelling in the brain and spinal cord. Infected babies may have health problems after birth, including seizures, blindness, and problems with the brain, heart, and kidneys. Listeria may be in the soil, water, animals, and in animal waste. The most common cause of listeriosis is eating food with listeria in it. Foods that are most likely to have listeria include unpasteurized milk and foods made with it. If milk is pasteurized, it's been heated to kill germs. Look for the word pasteurized on the label. Soft cheeses like feta, brie, camembert, roquefort, and Mexican-style cheeses like queso fresco, queso blanco, panela, and asadero. Deli meat, hot dogs, juice from hot dogs, and dry sausages that are chilled or at room temperature. Unwashed fruits, vegetables or sprouts, cold salads from delis or salad bars. Refrigerated pâtés or meat spreads. Refrigerated smoked seafood, including Nova-style, lox, kippered, smoked, and jerky. None of the aforementioned foods should be consumed during pregnancy to keep your baby safe. Another foodborne infection that can lead to miscarriage is toxoplasmosis, which can be caught by eating raw or undercooked infected meat. According to the CDC, if you are newly infected with toxoplasma while you are pregnant or just before pregnancy, then you can pass the infection on to your baby. You may not have any symptoms from the infection. Most infected infants do not have symptoms at birth, but can develop serious symptoms later in life, such as blindness or mental disability. Occasionally, infected newborns have serious eye or brain damage at birth. Toxoplasmosis can also lead to miscarriage, especially if you are infected in the first trimester and not treated. Cats play an essential role in the spread of toxoplasmosis. They are infected by eating infected rodents, birds, or other small animals. The parasite is then passed in the cat species. Kittens and cats can expel millions of parasites in their feces for up to 3 weeks after infection. Mature cats are less likely to shed toxoplasma if they have been previously infected. Cats and kittens prefer litter boxes, garden soils, and sand boxes for defecating, and you may be exposed accidentally by touching your mouth after changing a litter box or after gardening without gloves. Fruits and vegetables may have contact with contaminated soil. You can also become infected by consuming infected fruits and vegetables if they are not cooked, washed, or peeled. If you're infected during pregnancy, medication is available. You and your baby should be closely monitored during your pregnancy. The third type of food poisoning is salmonella, is most often caused by eating raw or undercooked poultry, meat, fish, raw or undercooked eggs, and foods made with them. Salmonella can pass from chickens to their eggs. Even eggs that look normal can have salmonella. Don't eat food made with raw eggs, including homemade mayonnaise, hollandaise sauce, Caesar salad dressing, cookie dough, frostings, and homemade ice cream. Unpasteurized milk, milk products, and juice or foods made from them. Milk and juice often are pasteurized. Look for the word pasteurized on the product label. Foods that come in contact with animal poop in the soil or water where they grow. These include mushrooms, fruits, vegetables, and vegetable sprouts like alfalfa, clover, radish, and mung beans. There are case reports of salmonella bacteria causing an infection of the amniotic fluid, the fluid that surrounds the baby during pregnancy. These infections are rare, but they can be serious and lead to miscarriage. There are several medications that can lead to a miscarriage. Medicines that elevate your risk include misoprostol prescribed for conditions such as rheumatoid arthritis, retinoids prescribed for eczema and acne, methotrexate prescribed for rheumatoid arthritis, nonsteroidal anti-inflammatory drugs such as ibuprofen used for pain and inflammation. To be sure a medicine is safe in pregnancy, always check with your doctor or pharmacist. Almost every drug passes from the mother's bloodstream through the placenta to the fetus. Both marijuana and cocaine, as well as other illegal drugs, can cross the placenta. Marijuana used during pregnancy may be linked to cognitive and behavioral problems in the baby. Cocaine use can lead to miscarriage, preterm delivery of the fetus, premature detachment of the placenta, high blood pressure, and stillbirth. Infants born to cocaine-using mothers are more likely to have low birth weight and may have an increased risk of sudden infant death syndrome. Using dextroamphetamine and methamphetamine can cause miscarriage and preterm birth. Newborns exposed to these drugs in pregnancy often have signs of withdrawal, like jitteriness, trouble sleeping, and feeding. They can also later have problems with tremors and muscle tone. They may also be at higher risk for SIDS. Researchers analyzed 24 studies conducted between 1970 and 2019 that included more than 231,000 pregnant women. What they discovered was even small amounts of alcohol increase the odds of miscarriage by 19%. In women who have less than 5 drinks a week, Each additional drink a week during pregnancy was linked with a 6% higher risk of miscarriage. Recurrent miscarriages. Frequently, women who have suffered a miscarriage worry that they will suffer another miscarriage if they get pregnant again. Thankfully, the majority of women only suffer one miscarriage. It's a totally singular event. About 1 in 100 women experience recurrent miscarriages, and most of these women go on to have successful pregnancies.
Like, comment, subscribe.